Hi, I'm Dr. Janet Pope. I'm reporting at Room Now here in beautiful Vienna, 2024 Eular. I want to tell you three things that I think might be the cool hot topics in lupus at this meeting. So there's three areas. One is biomarkers, one is prednisone poison or not, and the third one is really looking at undertreatment of membranous lupus nephritis. Let's talk about membranous lupus nephritis first. That's poster 0732, that's the Toronto cohort, and what they're finding is that when they've looked back over the years, that membranous also has a poor prognosis, not as poor as GN, but not as good as we might have thought. And maybe that's food for thought that we should be giving more immune suppression to that group. The next thing is, what about biomarkers? So there was one biomarker study looking at IL-16 in the urine of patients with GCA, and it has been found in last year and in other years that it's an important biomarker in urine and lupus patients. But there was a soluble biomarker study this year, OP0255, and it really is not ready for prime time, in my opinion, because it's hard to know, is this validated? But it did find big differences, but some of these cytokines can change over time. We'll see. The final thing is, prednisone, is it good, bad, or ugly? Certainly in all the guidelines, including Eular guidelines, the least amount of prednisone is the best. So Monash and his group looked at the Pacific Australia lupus patients, who are a really large cohort now. And what they found was that if they looked at patients in low lupus disease activity of 7.5 milligrams a day or less of prednisone, or they looked at a group of 5 milligrams a day or less of prednisone, the bottom line is they found that damage was no different between the two. There's a caveat though. Of the thousands of patients' visits, 104 of the patients only were between 5 and 7.5 milligrams of prednisone. So everybody else is included twice, in the less than 5 or the less than 7.5. So I don't think we have the answer out. And for now, what I would say is prednisone, the least amount that keeps your patient in a good disease state, is the best. Great, thanks. Follow me. I'm at Janet Bordeaux. Thanks.